सुबोध है। मैं 54 इयर्स की हूँ और मैं हाउसवाइफ हूँ।
पिछले अक्टूबर 2015 में इनको कुछ प्रॉब्लम आई और उसमें सीटी स्कैन वगैरह हुआ, उसमें डायग्नोसिस हुआ कि इनको आंतों में कुछ ऑब्स्ट्रक्शन है। तो उसके लिए फिर हम जो हमारे एक परिचित डॉक्टर हैं, डॉक्टर संजय रैना, उनके पास गए। उन्होंने मैक्स हॉस्पिटल का रेफरेंस दिया। हम उसके बाद अब यहाँ पे मैक्स हॉस्पिटल में आए। डॉक्टर अर्चित पंडित से हमने मुलाकात की तो उन्होंने कहा शायद हमको इनकी सर्जरी करनी पड़ेगी।
So she was a 54-year-old patient who is presented with recurrence in the CA ovary, and the first time the disease was diagnosed in 2013 and the treatment was completed in 2014, which included cytoreductive surgery followed by adjuvant chemotherapy. And this time when she presented with a solitary pelvic mass which was abutting the rectal area, and we suspected that probably it is infiltrating the mucosa of the rectum as well. So we performed a PET CT scan and a colonoscopic biopsy.
तो जैसे हम नॉर्मल सर्जरी के लिए आए, एडमिट हो गए, तो हमारा पूरा फाइल वगैरह चेक किया, ये किया। तो डॉक्टर साहब ने हमको सजेस्ट किया कि आज की डेट में एक नॉर्मल सर्जरी के साथ में हाईपेक प्रोसीजर is also available, and that is the most successful procedure.
So what is basically HIPEC technique? It is basically hypothermic intraperitoneal chemotherapy, and basically this is usually advantageous technique in certain subgroup of patients which have tumors basically which have a tendency to recur in the abdomen itself.
When we remove whole of the lining of the stomach and abdomen, and along with that we give a chemotherapy inside the abdomen during the surgery. There is a special machine for that which we have now, and that chemotherapy goes on for 45 minutes to 1 hour at a regulated temperature, that is a temperature of 42 to 44 degrees centigrade. At this temperature this effect of chemotherapy increases and more cancer cells which are microscopically left behind after the surgery are killed.
And the challenge that we had was to do a total peritoniectomy and a HIPEC procedure along with bowel resection that we had to perform in this patient, because the recurrent disease that was there was mainly confined in the pelvis of the patient. As we know that the first surgery has been performed and the pelvis becomes completely empty. Now whenever there is an empty space, the bowel, small bowel or the large bowel, goes back into the pelvic cavity, and that is where the bulk of the disease appears. Now when this cavity is filled with cancer cells, these cancer cells infiltrate or involve the small bowel and the large bowel cavity. Bowel resection is mainly a large intestine or a small intestine, and in this particular patient we had to perform a large intestine resection, that is also called as a low anterior resection, and we have to anastomose the large bowel with the large bowel. Also the small bowel had gone and stuck into the pelvic cavity because the pelvic cavity was empty because of the first procedure, and the small bowel also had to be resected. So mainly this patient had 2 anastomosis that puts this patient into a very high risk.
लाइफ मीन्स प्रॉब्लम तो आएंगे ही, प्रॉब्लम और किसी भी स्टेज में आ सकती है, किसी भी आदमी को आ सकती है, लेकिन उस चीज़ को फेस करना और एक हिम्मत के साथ करना जो है, यही एक अच्छी लाइफ का तरीका है जीने का जो है.
Because we have been doing this procedure for quite long, 6-7 years. So recently we had a HIPEC workshop in the Asian Clinical Oncology Society conference. After that we got enthused to start this procedure at this part of Delhi. Hence we will continue to give this benefit to our patients. Even for poor patients we have some subsidized cost, because the cost of the HIPEC is also quite high. So we will be giving this benefit to all the patients coming for the treatment in this part of the country.
तो इनकी सर्जरी हो गई. सर्जरी के बाद में भी 5-6 दिन तक काफ़ी जो है ऑब्जर्वेशन पर रखा गया, काफ़ी इलेक्ट्रोलाइट्स वगैरह चेक किए गए और प्रोटीन वगैरह की काफ़ी लिक्विड्स दिए गए और वो मेंटेन हुई. तो नाउ शी इज़ वेल जो है.